series of different types of hand movements and hand techniques in order to affect change in the soft tissue, in the energetic field of the body, and in the joint relationships. The theory with treatment of diseases of Tui Na is the same as in acupuncture. We're looking at the body as a complete energy field with qi that flows through channels and meridians. We're looking at those as the major factor in health and in disease. So our primary goal is to restore harmony to the circulation of qi through the channels. In terms of treatment principles, our first goal is to relieve pain. Pain in Chinese medicine is caused by a stagnation of the qi and blood. So our techniques, generally focusing on what are called oscillating techniques, seek to activate the circulation of qi and blood. Then we want to begin to relieve the stagnation of qi and blood and begin to move more deeply into the circulatory system, to begin to work with the specific points and channels associated with where the area of pain is. From that, we go to relieving obstruction. We now focus directly upon the area that is causing the obstruction to the circulation of qi and blood. These techniques tend to be more pressure-oriented. They're often heavier, but our goal is to remove the obstruction and release the qi and the blood. Our third principle is to harmonize that circulation. So we now go back to working with the channels and with the soft tissue in order to harmonize the circulation of qi and blood, releasing the stagnation, removing the obstruction, and harmonizing the circulation of qi and blood. And finally, our fourth principle is to restore functional anatomy. Whenever there is trauma or pain in the body, there is a distortion in the joint and muscle relationships. So through the use of passive joint movement and traction, we restore functional anatomy, each time working to create a greater harmony in terms of the movement of the body. What's important in Tui Na is to practice very diligently on learning the hand techniques. There are a wide variety of protocols combining these hand techniques in a whole variety of sequences for different disorders. But until you attain a certain level of proficiency with the hand techniques, the protocols just don't work as well. So that what's important is to begin to practice diligently, continue to practice, and then begin to focus on the protocols.